Hey everybody, Dr. Ed Gigliotti here. Today I want to go through and answer the question, why is advanced imaging so important? There's a number of reasons, the first being to rule out or to discover if there's any pathologies. Pathologies is pretty much just looking for diseases, which are often found on different types of advanced imaging like MRI, CBCT, X-ray, things that you can't see because your skin's covering it. So with this 3D technology, I'm going to show you some things here on this individual. This individual that we were blessed to care for actually did have a pathology that changed how we had to care for this person so they could get their life back. So this here is a view from behind, back of their skull, back of their neck, okay? And this imaging technology is called CBCT, cone beam computed tomography, okay? It's really, really cool technology. So there's the left side of their jaw and the right side. How cool is that? So what we can do with this technology, I'm going to open this up here. This here is a view from the side, okay? An X-ray view from the side. This would be what it would look like in regular X-ray. So there's their dental work, okay? And then there's their bottom of their skull, their atlas bone, C2, C3, C4, and C5 down there. We can see just top of C5. So when we did the analysis, we send out every set of imaging we do to a trained radiologist just to get another set of eyes on it. So we have 4 doctors in our office looking at it, and then we also send it out to get another doctor who just looks at radiology reports all day. So that way they can get their eyes on it to make sure we're not missing anything. Now this here, what this individual had, what I'm doing now is I'm making the imaging very thin, okay? So this is the regular thickness of an X-ray. Now I'm going to take it very thin, like paper thin. And I'm going to scan this joint here, okay? Now this here is the opening of the inside of the canal, all right? The brainstem would come down to here, and then there's the spinal cord. Now look at these vertebrae. Look how they have this white matter here, okay? What that is that's calcification, that's bone. That's rarely ever inside the spinal canal. So this body has actually adapted over time, and what this is called OPLL, or it is ossification of the posterior longitudinal ligament, pardon me, okay? So this right here, what's happening is this ligament inside is calcified, and it's actually fusing these levels together, C2 to C3 and C3 to C4. This is an absolute contraindication, and what that means is do not use forceful adjusting on this area, okay? Without 3D imaging, we wouldn't have known that. We wouldn't have known that. This individual was actually going to another health practitioner and was getting more forceful manipulations of the neck with the style they were doing, and was actually getting worse results afterwards. And imaging showed clearly why. So this was crucial for caring for this individual that we had to stay away from that area there. Couldn't do forceful adjustments because, not that we do forceful adjustments, but he would never want forceful adjustments in those areas because this bone, this ligament that's ossified could actually crack, okay? And no fear, no doom and gloom. This was a rare circumstance, but this is why the imaging is so important, situations like these. Or if we need to co-manage, if we need to send out somebody to another health professional because there was something found on the report or that we seen with the imaging, that co-managing for a certain sickness or illness or disease process would help them get their health back even quicker and better. Okay? Second reason why it's so important is to rule out fusions. Fusions are when you have different levels fusing together. So stuck together like 2 vertebrae, which shouldn't be stuck together. All right? We could see this one here. This is a unique fusion. It's off the, there's in the front, which is referred to as dish, but then OPLL, which I just went over with you here. These vertebrae are fused together. So we could actually scan all the way to the left and the right, okay, of the joint. So this is the left side of that person's, neck, and there's their chin and their teeth here, and this is all the joints. So we're actually looking at it if you're looking on the 3D. We're going to scan here, and then we're just going to take slices from the side going here, here, and we could see if there's any fusions along those joints. So this again is a side view. of an x-ray view, right? Okay, that's what it would regularly look at. Like, I'm going to do the thin view again. Okay, and then we're going to scan. We're going to go from the left to right, and I'm making sure it's all separate. And in this case, it's not. You can see that, like I've already pointed out, that these are all fused together. Okay, that is super important to knowing which segments are misaligned and which ones not to touch. Because if they're fused together, there's nothing that can be done at that point to those levels. You can adjust the levels above and below if there's pressure on the nerves, which could be so beneficial. But you have to know which ones to stay away from too, or which ones wouldn't be beneficial if they were adjusted. Okay? So ruling out fusion, something that you can, there's no way I know of by doing that by looking at the outside of someone. Okay? You need advanced imaging to rule out that there's no cervical fusions. Okay? What we find is so darn important, and this is our specialty. The last reason I want to mention today is to actually determine accurate cervical misalignments. So to accurately find out how the bones have twisted out of place, putting pressure on the brainstem, spinal cord, putting tension on that delicate system. Okay? We're talking millimeters of movement, which can have profound effects on people's lives and health. So with this technology, we can actually look at each joint. We can look at each level. Okay, another thing we can do is we can look from the top down. So this is from behind. We could look right down the canal, and we could find out, has there been any injury that's occurred that these vertebrae have slid out of place, putting direct pressure on that brainstem and that spinal cord and haven't been addressed before. These vertebral levels can misalign in very unique and complex patterns. They're not just like they go left or they go right. When they malposition, we've seen them go forward under the skull on both sides, backwards. We've seen them counter twist with levels above and below. And remember why that's important. It's not about bones twisting out of place. It's about what it means for that person's life and their physiological function. You have the brainstem coming down through the top of your neck. And remember, this is looking from the top down. Okay? You have blood flow. You have cerebral spinal fluid flow. You have all that coming through this delicate area, including all the neurological function. Millions, billions, trillions of nerve signals every second to a few seconds going back and forth through this corridor. So if there was ever pressure here, it's like, think about what that would do to somebody's whole quality and quantity of life. Like the whole direction of their life could and would change in a direction they might not want if there was a significant injury here that was overlooked. So finding out how these vertebrae have twisted out of place, it takes the guesswork out of it, where you can actually see where the most probable tissue and ligament injury is that's allowing it to malposition. And then we can calculate accurate adjustments that are unique to your case or your family member's case, and make them gentle and specific. When we know the very gentle or the correct vectors or the correct direction to adjust, you could go very gentle, like moving a door on a hinge. If you know the way the hinge is formed, it's like all you have to do is very lightly push that door. It could be 400 pounds, but it'll swing on that hinge easily because you're going along the joint line, right? Another thing is knowing how to make a care plan. Like, to accurately assess how to care for you and your loved ones, when we have imaging, we know how much arthritic change there is, how long the injury's probably been there, how long tissues, ligaments, tendons, muscles will most likely take to regenerate based off of the degeneration or the lack of degeneration we're seeing, right? And another thing is, when we're looking at these cervical misalignments, we can, with this 3D imaging, monitor conditions and monitor improvements with your health. It's one thing to say, oh, I feel better, which is great, right? But it's another thing to say, I'm functioning better. That the pressure is getting off this system, and you could say with certainty with measurements before and after, and you could see that. So for the reasons I just stated, ruling out or discovering pathologies, finding out if there's any fusions, and then also calculating precise misalignments, or calculating how to adjust misalignments in a precise, specific, and gentle way, along with knowing how to make care plans and monitoring improvements, is why advanced imaging can be the game changer with your health. If you felt discouraged before, you've tried chiropractic, you've tried other things, and you're just like, I'm just stuck in the way I'm going, this might be able to help you get some answers that you haven't been able to get before. So take that in consideration. We'd love to help. If you're not in the area, we can help find you a doc in an area that may be able to look at things from a different light to help you transform your health and your life. We love and appreciate you guys. Thanks for spending a few minutes with me today. Share this message. People need to know it. We're not in 1905 anymore. Like, there's just so much amazing technology to help people live life better and to transform their future. Thank you.